Advocates are alarmed at the growing mental health gap in Victoria as the transition's made to the National Disability Insurance Scheme. An estimated 135,000 people with mental illness aren't eligible for the NDIS. And critics say job cuts to more than 900 support workers will be a blow. Here's Social Affairs correspondent Norman Hermont.
This is what community mental health outreach looks like.
Hi, Andrew.
Support worker Robin Stringer is making a home visit to Andrew Gibbard, who lives with severe schizophrenia.
Hi, how are you?
Robin is virtually the only visitor Andrew ever has. He lives alone in sparse surroundings. Robin is a lifeline.
I have to deal with schizophrenia all day, every day, which is a lot of voices I have to talk to, argue with, debate things with. She breaks up my isolation as well, very much so. To have Robin come over, because at times I am very isolated.
I've got the capacity to sort of meet with all of his different people that support him, all his medical, his doctor and so on.
Robin also makes it possible for Andrew to venture out for rare trips, like this one to a social service agency to check on documents.
Andrew, I've got this application that we filled out, do you remember? Yeah.
It's vital support, and it's about to end. Robin's position is funded by Victoria's Mental Health Community Support Services program, which will cease to exist with the transition to the NDIS.
We're going to be losing a lot of workers that are really skilled in mental health. So there'll be quite a lot of us that just go into other fields, I suppose.
So they're completely MHCSS funded, so it's really, really bad.
The union that represents most of these workers says more than 900 jobs will go by July next year.
Once they're gone, they're gone. The highly specialised community-based mental health workforce capacity will disappear.
The Victorian government says it's working to soften the impact, and it says the average NDIS package is nearly 3 times the average funding clients receive under the current program.
Sam, out you go!
The problem is most Victorians living with mental illness, an estimated 135,000 people, aren't eligible for the NDIS. Nikki Wall lives with bipolar disorder and was rejected by the scheme. She often pays for her own care, but worries others can't afford that.
They're left isolated, alone and flailing without those supports.
Thanks for that, Robin.
Yeah, no worries.
When Andrew Gibbard joins the NDIS, it's likely his home support workers won't have any experience dealing with mental illness. And they won't be Robin.
I guess I'll miss Robin. I hope she'll get a good job, and hopefully it's not too rocky road.
Norman Hermont, ABC News.